For about a week now, Colorado kids as young as 12 have been getting their first COVID-19 shot with the hopes that it leads to a more normal summer.
I'm excited to be able to have the vaccine because I'm working at a summer camp this summer, so it'll be nice to be fully vaccinated.
Starting with our grandparents and having them taken care of first was good, and then now getting these guys and just in the nick of time for summer and activities.
Just in the nick of time. Well, welcome to this Denver 7 special on children and the COVID vaccine. I'm Shannon Ogden, and over the next half hour, we will attempt to answer as many of your many questions as we can. And by we, well, let me introduce our distinguished guest tonight, Governor Jared Polis of the great state of Colorado. We also have Dr. Eric France in the bow tie. He is Chief Medical Officer for the Colorado Department of Public Health and Environment. And Brandy Emily, Deputy Director of the Immunization Branch of CDPHE. Thank you all three for being with us tonight. And before we get to questions for you, I want to take a little snapshot of how parents are feeling about their children getting the COVID vaccine. A recent Kaiser Family Foundation poll shows only 29% of parents plan to get their children vaccinated right away. 32% said they are going to wait and see what happens. 15% said they would only have their children vaccinated if their school required it. And then 19% are a hard no, saying they would not be vaccinating their children. So, Governor Polis, first to you, does this surprise you, the results of that, or is that what we expect when there's a new vaccine?
Well, look, we hear from so many parents that are just so excited that they can finally protect their kids. I wish I could protect my kids already. They're 6 and 9. They're not eligible yet. It's 12 and up. But hopefully by fall, my kids will be able to get it too. So, we got 11% of the 12 to 15-year-olds got vaccinated in the very first week. And I think we'll get to that, 50, 60% very soon. And I would just encourage parents of 12, 13, 14-year-olds to don't put it off, get it done. Make sure your kids are protected over summer. The biggest group of increase of hospitalizations we're seeing are young people, teenagers and 20-somethings. And we know what's worked for people in their 70s and 80s and 60s. The vaccine brought the hospitalizations down to a very low number. It'll do the same for kids.
Well, that was actually our first question from a viewer from Erica. Wanted to know if you really would give your kids this vaccine. So I think that is a definite yes. Now to Heather, who wants to know why this is being, she says, pushed on our children, her words, since the survival rate for kids 12 to 15 with COVID is so high. So Brandy or Eric, either one of you want to take up that?
I'll certainly take first stab. Thank you for having us tonight. I will start by just pointing out that those numbers from that Pfizer survey fits very, very much into the part of how all new vaccines start. As a pediatrician with almost 30 years experience, while there's some hesitancy at the beginning when people see how effective and safe these vaccines are, they quickly want to become vaccinated. So I think in general, though, that we've got great opportunities with our vaccination for these kids. We do want to get these kids vaccinated. There are rare events that can happen that lead to hospitalizations. We vaccinate kids against meningitis, a very rare disease, measles, thankfully very rare disease, tetanus. So these are all rare diseases. It's important, though, for families to feel like they can get back to their lives. And really, as much as this is an important vaccine for protecting individuals from sickness, it's also about just returning to our normal life, going to camp, being a camp counselor. And I think that's where the excitement is with this vaccine.
So to Brandy, Emily, if you would take up this next one, how are you? And I'm sure this, because it's happened to me, I'm sure, gosh, it's happened to you all every hour on the hour. How are you selling this vaccine to parents of children now eligible?
Well, I guess we are really taking a very data-driven approach at the state level. And we know that schools and childcare and even our higher education are currently having the highest proportion of newly reported cases. And so we really know that it's very important for every Coloradan to get vaccinated. And that includes our young people. Our students can spread the disease, even though we know that they don't get as sick. In most cases, there's rare cases where children get seriously ill with COVID-19, and they've been hospitalized in the state.
So, Governor Polis, to you, I want to compliment you and the rest of the team, the state. I think you've done a wonderful job with these ad campaigns, these PSAs, encouraging people to get their shots. You made a bona fide star out of Dr. Hurley. But is there going to be some sort of ad campaign, you think, focused toward the parents to convince them it's okay to get your kids a shot?
Yeah, Dr. Hurley's Hollywood agent's phone is ringing off the hooks now. We just want our state to get a cut. I think the people that listen to Dr. Fauci or Dr. Hurley or Dr. France or President Trump or President Biden, they've gotten vaccinated because all of those trusted authority figures have said get vaccinated. Who's left? People that have a distrust of authority. That's okay. Nothing personal. They don't trust me. They don't trust Dr. France. They don't trust Dr. Fauci. They don't trust President Trump. Don't trust President Biden with their health. I get it. Who do they trust? Their doctor. So really it gets into this phase where families talking with their family doctor, their pediatrician. They have the facts. They're armed with them. They know how to have those discussions. When kids are going in for checkups over summer, their pediatricians are having that conversation with the parents. And frankly, look, I think this is the most important vaccine to get right now. All those other things are still out there. Tetanus, measles, they're out there. But this is the only one that infects 1,000 Coloradans a day right now, at least. So I think it's the most important vaccine for kids to get. I'd have peace of mind once my kids have it, and I can't wait till it's approved for 9-year-olds and 6-year-olds.
Yeah, you and me both. I have a 6-year-old as well. And so let's go to a question from one of our viewers here. Actually, many viewers ask a variation of this question, and this is to whoever wants to take it up. Is there any concern about giving this vaccine to those of puberty who are developing right now?
I'd be happy to take that. These vaccines were studied most recently in 12 to 15-year-olds. And so we've got some good data to make the decision that it's time to vaccinate these kids. And as our parents know, 12 to 15 is smack in the middle of puberty for many of our children. So certainly puberty was part of the group that was being vaccinated, and no unusual or new findings from a safety perspective. 100% efficacy, worked 100% in protecting kids against COVID. Nothing about this vaccine suggests it could interfere with puberty, just like none of our other vaccines that we give to children 10, 11, 12, 13 have an impact on puberty.
Very good. Let's get to as many of the questions from our viewers as possible. This next one from another mom concerned. And actually, she has, it's in two parts. Her name is Cookie, and she asked, what about the safety of the kids under 12, toddlers, babies, etc.? Can we be carriers to this group? Good question. In fact, I think you took that up today in the press conference, Governor. Second, how close are they, that age group, to getting the vaccine, kids 12 and under?
So let me address this real briefly here. First of all, for anybody who's worried about safety, tens of thousands of 12 to 15-year-olds were in the trial group that signed up ahead of time, said, I want to try it. It worked. No bad health effects, and even better viral protection than older populations. That's not unusual. There's different immune systems, strong response. 100% effective for 12 to 15-year-olds. It was 95% effective, people in their 60s and 70s. Again, that's not unusual. There's evidence that, for instance, a different vaccine we don't use in America called AstraZeneca is less effective among older people than it is among younger people. So Pfizer vaccine, very close to 100% effective for younger people. The clinical trials for age 6 to 11 and younger, those are being enrolled and conducted as we speak. The paperwork has not been submitted. We hope it gets submitted by the end of summer. It usually takes the FDA 30 days or so to turn that around, as it did for the 12 to 15-year-olds. So the best expectation at this point is probably fall for younger kids.
And what about us being transmitting the virus to that age group?
Well, we know that if you've been vaccinated, the amount of virus that you have of COVID, if you get sick with COVID, is much lower than if you have not been vaccinated. So the ability for you to spread it to others in your family is much lower if parents and older children are vaccinated. As a matter of fact, we call it cocooning when we have everybody in the family vaccinated, when the young person in the family cannot because of an age restriction. So we're effectively protecting that young child by being sure that all adults and older children get the vaccine.
Cocooning, I learned the term from you at the press conference today. All right, let's hit pause right here. We're just getting started on this very important topic. I know a lot of parents are very concerned and grandparents as well, and we're going to try to ease those concerns right after this. Welcome back to our Denver 7 Town Hall on children and the vaccine. Of course, it's been such a long year for students during the pandemic, and some are hoping that getting vaccinated before the next school year will help return things to normal.
Just getting everything back and being able to go to school again and hanging out with more people and not having to stay inside all the time.
I'm ready for them to get back to school. I'm over the homeschooling. I am not a teacher.
Oh, Nina, I am not a teacher either, as my daughter has seen. But as we have seen tonight, there is a substantial number of parents not quite yet gung-ho on getting this shot for their children. All right, let's reintroduce our guests tonight. Governor Jared Polis, Colorado's Chief Medical Officer Dr. Eric France, and Brandy Emily, Deputy Director of the Immunization Branch of the Department of Public Health and Environment. Everybody's here till 7, answering as many questions as we can. So let's get to the next question. Another mom wants to know if vaccinations will be required for students to go back this fall. She says, are there talks happening between the state and school districts about how to handle kids that are vaccinated, are not vaccinated? Will my child be quarantined from school next year if not vaccinated? So whoever wants to take that, please do.
I'll take it briefly. And by the way, I think it's great that Colorado has been one of the states that has been leading in getting kids safely back to school. The majority of our school districts were actually in session all year in person, but some of the larger metropolitan ones came in January, February. There are still schools in many states that are not back in person, and that's been a big priority of ours to do it in a safe way. Right now it affects the quarantine guidance. Essentially, if you're fully vaccinated, you don't need to quarantine. And that's mostly teachers at this point. But there are some 16, 17-year-old, 18-year-old students that no longer need to wear masks in the school if that's their district policy. And in addition to that, they no longer need to quarantine. So that's the main benefit. While I don't expect that, I expect next year we'll be back in person more or less normal, there will likely be outbreaks of the virus in some schools, and there will likely need to be people that quarantine, and some of them will contract it. So that's another reason, of course, to get vaccinated, is make sure that you can avoid getting it if it comes to your workplace or if it comes to your school.
So the next question, do you think we'll see a vaccine approved for kids younger than 12 by the time the school year starts? I know I'd heard early on that they hope to have this going approved for Pfizer by September, but it seemed like in the last couple of days they might have pumped the brakes on that a little bit. Do you know the latest on that?
I think we still anticipate it will be fall before it's approved for those younger than 12. They are in trials with Pfizer, the Pfizer vaccine, but we don't anticipate it being approved before school starts in August.
And Dr. France, do you have any insight into how the trial's going on that age group, the 6 to 11, I guess is what it is?
That's right. It's the school age kids, essentially from kindergarten up through 11 years of age. And all that information is kept closed up because they're blinded and they don't know who got the vaccine and who got the placebo until they look later in the summer. So no news yet about how that's going.
So I want to get away from a viewer question for a second and have a discussion with you all on this. And I tried to get at it at the top. The hesitancy we're seeing, is that sort of in line anytime there has been new vaccines? Because you look at the full slate of required vaccines for kids to go to K through 12 here in Colorado, it's a lot. And aside from the hardcore anti-vaxxers, nobody's talking about it. You just go to your pediatrician, you get the shots. So is it just because it's new, or what's the deal here?
I think it's because it's new and because we're in the middle of a pandemic, so everybody's focusing on it, and it makes for a good story to talk about how people are hesitant about it. So whether we look back to 1995, when as a pediatrician we introduced the chickenpox vaccine, or in the 2000s, it was the meningitis or the HPV vaccines. There's always this pause. There's some people that jump right in. They know people with these diseases. They want their children vaccinated right away. Another big group that comes right up next. And then there's a group that is unsure. They want to ask their doctors, their trusted nurses, the questions that they have. So I'm not surprised. I think this is normal. And if anything, you can look back at our own COVID questions to families, and they started out with some saying that they wouldn't get it, but today they're all saying they would. So this really will change over the coming months.
And Governor, you know, the hardcore anti-vaxxers, they didn't have social media in the 70s and 80s to all get together and be at least projected a louder voice. I assume that's part of the deal here too.
Yeah, that's a relatively small group, and obviously, while schools require measles and many of these other shots, you can opt out of that. You can sign a form and you can opt out of that, and very few parents do. It's under 10%. I expect it'll be the same for this. Frankly, as a parent, if I would get one vaccine for my kid, this would be it. While of course there's a non-zero risk of measles and meningitis, by far the highest risk of them being hospitalized or even dying right now in Colorado is COVID-19. So that's the one you want to run out and protect them against, get the other shots too. But it's very important right now. We have about 1,000 people a day are still coming down with COVID. Hospitalizations are higher than they've been and been going up relative to other groups for teenagers and people in their 20s because lower vaccination than adults and older Coloradans.
And what about that? We have been, at least for the last couple of weeks, #1 in per capita cases until Delaware came and saved the day, and they beat us today, and we're #2. Are you particularly concerned about that, or are we going to knock it all down with this vaccine, do you think?
You know, we're watching the trend, and thankfully the trend is down. Hospitalizations have gone down now 6 days in a row. That being said, there's still 516 of our fellow Coloradans of all ages in the hospital for COVID. We have the room, not an issue. It's been going down. That's great. But it just shows we all need to be careful. If you're not vaccinated, wear a mask around others. You know, your kids who aren't vaccinated, get them vaccinated if they're 12 to 15, 16, 17. We just need to end this thing and move on.
Amen. All right, we'll squeeze in one more question before we take another break. Melissa wants to know, should I wait to give my child the vaccine shot closer to school so she's better protected for when school starts? I guess thinking of like we might need boosters. Brandy, Emily, you want to take that one up?
I would say no. If your child is eligible, I would get them vaccinated as soon as possible. There's talk about boosters. We don't have any information on that, but they will be protected 2 weeks after their second dose with the Pfizer vaccine, and they should be protected for school.
All right, Brandy, Emily, thank you for that. We're going to take another very short break. Still a lot ahead, a lot of questions to get to. We'll be right back. Welcome back to the special Denver 7 Town Hall on children and the vaccine. Just a few more minutes left. So let's get to this question. And again, whoever wants to take this up, kids who are not yet vaxxed, either by age or by choice, do you still want them to be wearing masks, and where should they wear masks?
I would encourage mask wearing indoors around other people, and then I would put the word especially around other unvaccinated people on there. If they're with a group of vaccinated people, the risk is very, very low. But if you're indoors in close proximity with a number of other people that are unvaccinated, wear a mask. Masks are about 50% effective, right? So now we have a vaccine that's 95% effective. And by the way, for 12 to 15-year-olds, very close to 100% effective, actually 100 in the trial group. So it's a lot better than a mask. Get vaccinated, but until then, wearing a mask will offer you some additional protection over not wearing a mask.
Who knew you were going to turn into such a infectious disease expert as the governor of a state? What a year this has been for you.
It's really annoying because I don't really like masks and I don't like getting shots. And so, you know, here I am having to sell this stuff, and it's no fun, but it's what we got to do.
So and I want to hear, I think, both from Brandy and Eric on this one. I was talking to a friend of mine who is fully vaxxed. Her husband's fully vaxxed. She has children within the 12 to 15-year-old age group. She's just scared about it. And I said, hey, have you gotten it yet? And she's like, I don't know. This is my baby. I don't know if I want to do this. And I'm hearing that much more often than any type of manifesto about I hate vaccines. So what do we say to these people?
I'm a mom as well. I have 4 kids. My youngest is 16, so was eligible a little earlier. And she was excited to get the vaccine, and we signed her up as soon as she was eligible. All of my kids are fully vaxxed, or half vaxxed as we call, meaning they've had the first shot and are waiting to get their second dose. I'm also a pediatric advanced practice nurse, and so I know that vaccines are safe. I followed the science, and I've looked, done research, and I highly recommend it to all of my friends and families.
So what are you saying to that, Dr. France?
Yeah, we've had over 1 million 16-year-olds in the U.S. receive these vaccines. The biology of a 16-year-old and a 14, 13-year-old is not that different. We know these vaccines are very effective, and we've seen it in the trials from the 12 to 15-year-olds. So try and reassure them that we know now that these are very safe vaccines, very effective vaccines, and that it always comes down to risk versus benefits. And the very, very, very minute risk involved with the vaccine is far outweighed by the benefits of preventing a hospitalization by COVID, ICU ventilation because of COVID, or death in a child by COVID, all which have happened in this state.
And that's another thing. We focus so much at the beginning of this thing on the elderly getting so sick that I'm afraid we've gone too far. People think kids are immune, but you're right. They can get this. All right, we have about a minute here left. I'd like to ask you, Governor, what are you thinking about pools? I got a couple of emails from viewers saying, are pools open? Are they closed? Some are open, some are closed. I don't know what to do. And is it safe for my child to go to a pool this summer?
Yeah, I hope that, pools are open. That's obviously up to whoever runs the pool. Many of them were open last summer as well. The water and the swimming is no danger or no risk. If they are in close proximity to other people who are infected, obviously they have a risk. I also want to get out there where people can take their kids to get the shot or where they can get the shot. Dick's Sporting Goods in Adams County is open 7 a.m. to 8 p.m. That's Sunday through Thursday. Denver Ball Arena is open Monday through Friday, 7 a.m. to 7 p.m. and Saturday and Sunday, 9 a.m. to 4 p.m. So really easy. Take them to Ball Arena or Dick's Sporting Goods, your local pharmacy, your doctor. Super easy. You don't even have to get out of your car. If they're 12, 13, 14, get the whole clan in a vehicle and get down there.
Make a day of it.
Get it done. Have fun.
Very good. All right. We're out of time, and I sincerely want to thank you all, Governor Polis, Dr. Eric Frandsen, and Brandy Emily. Thank you for your time, your expertise, and also for what you've done throughout this ridiculous pandemic. And knock on wood, we're almost through this. So thank you for watching. Get your shot. And please join me back here for Denver 7 News at 10.